Hi, and welcome to today's show. Today we have with us Dr. Wendy Schofer. Welcome to the show, Dr. Schofer.
Thank you so much. It's such a pleasure to be here with you.
Oh, it's a pleasure to have you. As a mom, actually, I am a grandmother and great grandmother too, but that's a long story. But as a mom of some young ladies, what you're going to talk about, I mean, that's huge. Women, mothers deal with so much, and fathers do too. And so I'm excited to delve into this, but let's get started by having you tell the audience about yourself.
My goodness, it's always something where I pause for a moment. I'm like, how am I going to do this? It's something I've been practicing over the last couple of years of introducing who I am.
Hello,
So,
I am Coach
hi,
Dr.
everyone.
Ann,
Welcome.
and welcome
I'm
to the
Wendy.
World of Women and Wellness
I
Warriors,
am
other
a
known
woman
as
who
WOW.
loves
A 2024
coffee. The
report by the
darker,
World
the better.
Economic Forum and the
Me too.
McKinsey Health Institute
Just
noted
order
that
some dark
each
roast.
year women lose
Dark
approximately
roast, black
75
coffee.
million years of life due to
Long
poor
walks with
health
my
and
dogs,
early death.
and the
The
sound of
World of
laughter.
Women and Wellness Warriors is a global
And that was something I actually
of
learned
women who
through
want to
my
be
work with the
empowered.
improv studio. And we can always talk about improv comedy too. There's so many threads. But they said, don't lead with what you do. Like, lead with what's important, the emotional experience. And so I've been practicing that a lot. Professionally, I wear a lot of hats.
Dr. Wendy.
So yes, I'm a doctor. I'm a mom. I'm a pediatrician, board certified with pediatrics, lifestyle medicine, and I have been really working on getting that connection about health. What is healthy for us as parents, for our families, and connecting with families outside of the office. And so I'm the founder of the Family in Focus programs. And that's me in a nutshell.
That's funny you say that. So you are a lifestyle medicine physician as well?
Yes.
See, I was going to pull out my book. I am I am going through lifestyle, the American Academy of the American College of Lifestyle Medicine now, and I was on the site getting ready to register for the October conference earlier today. So I absolutely love that because learning the significance of lifestyle, the significance of everything from whole food, plant-based diets to stress management to, restorative sleep, relationships. It's amazing. We weren't taught these things in medical school. I wasn't. I'm older than you. But the potential to completely transform a person's life prior to that first prescription is just huge.
Yeah.
And my kids, I'm always on them. You know how it says avoid toxins. So they know when we're shopping, they look at the label. Oh, Mom, this has chemicals in it. So I certainly look forward to your talk. So I am going to just sit back and listen because, again, I have children at home I'm raising. And so I can't wait to hear what you have to say.
Oh my goodness, that sounds like a wide open door. But how much of it is about, connecting as one person to another, like seeing each other, seeing what it is that we're going through right now. We were, joking around before we started, the recording about, phones going off and our families that are needing us and how it's like that moment of, okay, hold on a minute. What was I doing? I'm being pulled in all these directions. And that's just kind of where we are as parents right now. Yeah. And so I think that so much of what shifted for me, so, I'm a pediatrician. I always worked with, parents in the office who just want to do the best for their kids.
Yeah.
We would bring them in and they would just say, please, doctor, fix this. And so over time, I found that more and more of those conversations were about mental health and about weight. And, I knew all the things to do. I would write out a plan. I would say, this is the prescription. This is, even looking at the prescription for how much to move, what to eat, portions and everything. I'd say, come back. Nothing happens overnight. Let's meet again in a couple of months. And they would come back and they're like, this doesn't work. This doesn't work for me. I don't like exercise. my kid doesn't like exercise. We have, food fights now. I'm finding candy wrappers underneath my bed or, underneath my child's bed.
Mm-hmm.
And the parents are stressed and they're just, feeling like there's more tension being created as we're trying to fix all this. And then the child is kind of slumping in the corner because they're feeling like there's something that they're doing wrong, something that's wrong with them. And so I recognize that there's a lot of things that I was doing with the best of intention, and yet it wasn't having the impact that I wanted.
Mm-hmm.
And to be honest with you, I was struggling with the same things in my own home. And so, a lot of times you get the message, well, you got to work harder, you got to try harder. And all of that on
It's
parents
hard.
is just adding more and more. Like we need to connect, human to human, understand what's actually going on behind the scenes. I actually don't have the answer for what you need to do, but we can also explore a lot more about what it is that you're experiencing. And, I know I'm in the right, right place to talk about that patient empowerment. What that actually looks like
Mm-hmm.
is saying, you know what, I see you. There's nothing wrong with you. There's nothing that needs to be fixed. But yet, how can we make it a little bit better?
I like that approach. I like that a lot.
I definitely, I need it too. We all need it. We're stressed. The whole, we're all running on fumes right now. As physicians, as parents, as humans, we are running on fumes. And so looking at what is it that we can recognize why it's all kind of the draining, what kind of culture and environment we're in, and what it is that just refuels. What is it that, can give me that spark, that energy? And the spoiler is it doesn't come in a bottle. It's not the same for anyone else. It's what uniquely works for you, what you want to just, I don't know, play around with. I use a lot of language around play, go figure, as a pediatrician, but also just someone that I recognize play and fun and humor. That's actually what fuels me. And so how can I infuse that into my life all along the way? The answer is different for everyone.
That is for sure, because different children and different parents. I mean, we all have different things that motivate us, different things that scare us, different things that cause anxiety. And so it is not a one-size-fits-all approach. So what would you say to a parent who is struggling with a child and the candy wrappers,
Mm-hmm.
and just wanting junk instead of healthy foods, realizing that the patterns that they develop now could have tremendous implications later in life. So you want to start them off right, but it's a struggle.
I agree with all of that. It is a struggle. We do want to, do the best for our kids. We want to set them up with, all the habits that lead to a beautiful, long, healthy, fulfilling life. And I think that when we focus on all of those things, that feels really heavy to me. Like that is like lifting. I'm picturing like the whole thing with Atlas with the world on his shoulders. And that's like mom lifting family health
Feels
up
that way.
there. Yeah. And so I think that recognizing, first of all, that we're in this culture where we're thinking that that's all on our backs. And there's a lot of messaging around health about the things that we need to watch out for, how we need to steer this ship, how we need to there's a lot of control types of messaging. And the more that we try to control another person, the more that person from toddlers to teenagers to me will push back. You tell me what to do, and I'm going to tell you where to go. Go figure, my kids are just like me. The more that I would try to tell them no on something, they would be like, I'm in. I totally want to do it. I'm going to do it. I'm going to sneak it because it's now intriguing to me. And so when I hear those concerns, I know that the question is, how do I change this? And I say, we need to slow down. We need to pause here. We first have to understand what's actually going on, looking at the patterns without, there's a lot of like saying, well, this is the problem, without labeling it as a problem. Let's just look at the patterns of what's going on. What is it that you want to focus on now? But let's get really clear about the patterns. Get really curious about it. Okay, well, I'm finding wrappers, underneath my child's bed. Tell me more. And the telling more is trying to, help me get a little bit more information about what is the pattern that you've noticed. Maybe they'll tell me a little bit more about what types of wrappers. Maybe they'll tell me a little bit more about when they find them. Maybe they'll tell me a little bit more about, what's going on. And if not, we'll have to, explore this a little bit more. But, what is the emotional environment of what is your child experiencing? What are you experiencing when you're finding these wrappers? And I think that when you had mentioned before about, really connecting with the struggle, with what's important to someone, I heard the word values in my head, but all of this is kind of coming down to like, what is its emotions? What is it that is fueling you? What's important to you? What is it that you want more of? What is it that you want a whole lot less of? Right there is our emotional experience. I'm like, I'm always like wearing my emotions t-shirts, and like, it's just something that it's a part of every conversation, because that's our stress, our struggle. It's about the emotions that we're having, but it's also explaining so much more about the patterns in our lives. Everything that we do is because of an emotion, something that we want, maybe something that we don't want. I don't want to feel frustrated. So I turn to, my phone and I start scrolling. Oh, interesting. Like, why did I go to Facebook and start scrolling again? Hold on a minute. Let me look at that. And so the more that we get to get curious about why we're doing things, what is the environment, what is the pattern, the more that we can understand, have compassion for ourselves, share that with our kids, and then kind of building onto that, just start experimenting. What's a little experiment, a little step you want to try? Just to, maybe it's shifting something about, the amount of frustration that I feel when I find those wrappers underneath the bed. Maybe that's the first thing. Maybe I just don't want to feel so frustrated because it feels so awful.
I know that feeling of looking under my child's bed and my jaw just drops. Like, where did you get this stuff? Or opening the backpack and all this stuff falls out. Like, seriously? So I can absolutely relate to that. So we are going to take a quick break and we'll be right back.
Hello, I am Coach Dr. Ann, and welcome to the World of Women Wellness Warriors, other known as WOW. A 2024 report by the World Economic Forum and the McKinsey Health Institute noted that each year women lose approximately 75 million years of life due to poor health and early death. The World of Women Wellness Warriors is a global sisterhood of women who want to be empowered.
So we are back with Dr. Schofer today, and we're talking about parenting, the stresses of being a parent, and a lot of things that we're faced with. And stress, we should not overlook it. We should not minimize it. We need to do whatever we can do to optimize our level of stress, because that helps us be better parents, be better people, and just be healthier. So, Dr. Schofer, what advice would you have for parents who are struggling with some of these issues?
Oh my goodness. First of all, I just want to put it out there. You are so not alone.
Mm-mm.
Oh my goodness. I mean, this is where we are right now. In fact, just a short time ago, the Surgeon General made a statement, highlighting about the amount of parental stress that we're
Really?
experiencing and the impact that that has upon the health of our families. And when he said that, I was like, hold on a minute. Have you been like reading out of my book? So this is like straight out of what I've been tying this all together because, you know, parents are coming in saying, this is what's going on. I need you to fix this. And again, coming up with how that's kind of sounding like in the pediatrics office, like fix my child. We're not saying that, but I mean, this is the way that our brains work. We're looking for what is the problem and how do I fix it? Because that's how, our brains tell us that we survive to the next day. But
Mm-hmm.
we're constantly in that mode. And that's a big part of the stress. It's like, okay, I'm feeling something. What's the problem? Let me fix it. And so I think that a big step that we can take to understanding that is to really, slow down and get clear about what is it that is stressful. What is that stress? Because I think of stress as just a general word for I'm having an emotional experience here. Because, they talk about, you got good stress, bad stress, like you get like the stress in like different types of ways. Well, it's kind of like different emotions that we have, where there are ones that feel good and even ones that can feel good. Like I feel excitement about, you hitting record. But yet it is still stressful for me because I get all these kind of flurries on the inside. There's a discomfort. And yet, that's a stress. That's, I'm just getting clearer about what is it that I'm really feeling. And then there's other stresses where, I'm frustrated, I'm disappointed, I'm angry, I'm overwhelmed. And I think that the more that we can talk about what is the emotion that we're experiencing and understanding more of where that comes from. Why am I feeling this? It's very easy to just say, okay, seriously, I'm stressed because of work. I'm stressed because I don't make enough money. I'm stressed because look at my bank account. And yet I will offer that we could all agree on that, but no one's coming in to just save the day and change all of that. And even with the Surgeon General, I really appreciate what he's doing. And he's talking about all the systemic changes that need to happen. That is going to take a very long time for us to have the parental leave that we need and our families deserve. It's going to take a long time to address, the pay equity. Like there's a lot of big issues that are stressing for
Yes.
us as parents. And yet, when we can look at it, we can also look at what is the stress, the emotion that I'm experiencing. It is completely valid. Okay. There's no like trying to change that, but understanding that what does this mean to me? What is the perspective? What am I afraid of? What am I worried about? And I think that that's where, you and I have vastly different healing conversations with parents about, what's really behind that stress. What is it that we can understand more about it? Because ultimately it's, I think, telling us about what is truly important to us. I'm not stressed about things that aren't important to me. Whatever, it's happening somewhere else. It's still happening, but it doesn't mean anything to me. I'm
Mm-hmm.
not stressed. Again, because of, the perspective, the meaning, the feeling. That's all right here on the inside. It's not about all that stuff out there.
So you have some things in the works to kind of address some of these issues for people. You want to talk about that?
Oh my goodness. Yes, I would love to. There's been so much going on behind the scenes. over the last couple of months with Family in Focus. And so I have my signature program, which is, go figure, called Family in Focus, where I work with parents who are worried about their family's health and really looking at how can I sleep better at night? How can I feel kind of calm in all of this chaos and all of this stress? But to be the parent that I want to be able to help my kids grow up to be healthy amidst all this concern about, weight and mental health and the environment, that they're growing up in. And so that program is going to be starting up again with the whole community at the end of October. And I also have a number of different teaching sessions. I call it education, tools, and fun. So it's the ETF, where you get to experience the Family in Focus approach and really looking, what is the whole thing about emotions? How does that impact our family's health? I also have something, I'm sorry?
I said tremendously.
Yeah. And that's where, so I started up the Emotions Lab that's also going to be going live in the next couple of weeks, where it's specifically a self-paced course for parents to learn about emotions. Mm-hmm. We're teaching kids about social emotional learning. That's awesome. And then they're coming home and parents like, what are you talking about? Like talking about emotions, feeling your emotions. I wasn't raised this way. This is not a language that I know. And so I created the course to be able to share with parents so that they can learn on their terms. And it's not just about learning. It's also about how can I apply these tools in my unique family and life.
And so on your website, if a person goes to your website, it's intuitive. They'll be able to just follow things and click on the things that they'd like to learn more about, right?
Absolutely. You will have the link right to my landing page, and it's kind of like air traffic control. Everything takes off from there.
Okay. So also in the description to this interview, to this podcast, we're going to also have the link to the website. So go ahead and tell us what it is now, and then we're also going to have it in the description.
Oh, beautiful. Yes. WendySchoferMD.com. That's Wendy, WendySchofer, MD from medicaldoctor.com.
Sounds right.
I got to tell you, I wish the name was a little bit easier to spell, but at least there's only one of me, so it goes there.
That's okay. It's intuitive if you think about how to spell it. So now that you spelled it, it'll be easier for people to
there you go.
So I want to thank you so very much for being on the show, and we look forward to hearing great things about how the program progresses and how we move forward. And as a parent, I appreciate the information that you've given. And I know a lot of other parents will appreciate all this information as well, as will their kids.
Thank you so very much. I love being able to connect and to recognize. I'm just going to give you the shout out for the work that you're doing to connect with women and really empowering. Because I think that the more that we come together and see the light in each other, the more that we can all shine.
That sounds wonderful. I'll accept that. Thank you for that. Okay. Well, it is such a pleasure to really have an impact on people's lives, and that's why we went into medicine. That's what it's all about, is helping people. So this is just another extension for me and for you, and it's just a blessing to be able to be here.
Thank you so much.
You have a great day.